Good morning. Good morning. Good morning, everyone. Welcome. Welcome to our webinar, which promises to be an insightful and exciting one. We are going to make a start. It's really wonderful to see so many of you here with us this morning. So, good morning, colleagues. And as I said earlier, welcome to today's webinar, Fit to Lead, Prioritizing Health for Peak Performance. My name is Georgia Sinclair. I'm the Senior Manager, Leadership Development here at Mind, and I'm the chair for today's proceedings. It is an absolute pleasure to have you all here today. In today's fast-paced and demanding world, the connection between personal health and professional performance has never been more evident. Leaders across industries are realizing that achieving peak performance at work isn't just about strategy, innovation, or ambition. It's about making health a priority. This webinar is all about exploring the profound relationship between fitness, well-being, and leadership. We will delve into practical strategies, actionable insights, and inspiring stories that highlight how taking care of your body and mind can elevate your ability to lead effectively, sustainably, and authentically. Whether you are a seasoned leader, an aspiring one, or simply someone committed to personal growth, this session is designed to empower you with knowledge and tools to harness the power of health in driving peak performance. We are honored to have a brilliant mind presenting today, Mr. Everton Anderson, Chief Executive Officer at the National Health Fund, who will share his expertise and experiences. He will guide us through key topics such as, let's explore what it means to be healthy. Here, he will define health as it relates to physical, mental, and emotional well-being. We will highlight how leaders' health influences decision-making, productivity, and team dynamics. He will look at strategies for personal health management, and he will also share practical solutions for improvement by discussing the role of leadership in fostering a culture of wellness in the workplace. But before we begin, a couple housekeeping notes. This session will run for approximately 1 hour. We encourage you to engage with us, so therefore please feel free to share your questions either through the chat or the Q&A functions, both located at the bottom of your screen. Let's make this a vibrant, interactive, and enriching experience for everyone. Together, we can redefine what it means to be fit to lead and inspire positive change, both in our lives and in the lives of those we lead. Thank you for being here, and let's get started. I now call on Andrea Tusa, Manager Leadership Development, to introduce today's presenter.
Good morning, everyone. Our presenter this morning, as you were told, is Mr. Everton Anderson, and he has had an illustrious background which makes him more than able to present on the topic Fit to Lead, Prioritizing Health for Peak Performance. He is the Executive Officer of the National Health Fund and an ex officio member of the National Health Fund Board of Management since January 2013. He has held various positions as a health administrator, including Regional Director of the Western Regional Health Authority, Chief Executive Officer of the Cornwall Regional Hospital, and Parish Manager in the St. James, Westmoreland, and Hanover Health Services. As CEO of the NHF, several significant milestones were achieved through innovative services like the Quick Prescript mobile app and the drop-off and pickup service, waiting times at NHS-managed drugstore pharmacies were reduced from 3 hours to 30 to 45 minutes. Annual prescription processing in the public health system increased from under 1 million to approximately 2.8 million, demonstrating improved operational efficiency and service delivery. Additionally, ISO 9001:2015 certification was expanded to include pharmaceutical services, ensuring adherence to quality standards. Furthermore, the 40-year-old pharmaceutical warehouse was redesigned with a new warehouse management system to enhance capacity and service standards. These, in addition to other factors, resulted in his accomplishment of national recognition as a member of the Order of Distinction in the rank of Commander and the Monov School of Business and Management's Award in recognition of his outstanding leadership in public health over the last 2 decades. Everton obtained his Bachelor of Science degree in Management Studies and his Master of Business Administration in Public Sector Management from the University of the West Indies, Mona. Notably, the Cornwall alumni in 2020 became a Fellow of the American College of Health Care Executives. He has served on several boards, including that of the Cornwall College, Malden High, and Herbert Morrison Technical High School, and he's also the former director for the Montego Bay Chamber of Commerce. Outside of his professional duties, he enjoys cooking, sports, and spending quality time with his family. It is not surprising then that Mr. Anderson is the 2024 recipient of the Mind Public Life Award for Leadership Excellence, which was presented to him at the Mind Regional Public Sector Leadership Development Conference in July 2024. It is my deep pleasure to present to you Mr. Everton Jackson. Over to you, Mr. Jackson.
Good morning, everyone. I hope you're all hearing me loud and clear. Let me thank you for that kind introduction. I'm not offended at being called Everton Jackson. He's actually one of my best friends, if he's the pastor that you're referring to. Welcome to this webinar. Yes, is everyone hearing me?
Yes, Mr. Anderson, we're hearing you.
Okay, thank you. All right, so let me commend the team at Mind, not only for this session, but for your continued focus in providing quality education. You have done a tremendous job for many years now, and we have seen it and we do appreciate it. And thank you for the opportunity to share. Let me thank my own team who helped me to put together my own thoughts on this very important topic. And this morning we'll basically explore the link between health and productivity. And we will discuss some strategies for personal health management and attempt to recommend some practical solutions to foster a culture of wellness, which is very important. I had earlier tried to play a song that I like from Black Uhuru, and it says, to get a hit, you have to fit. You have to fit. To get a hit, you have to fit. To hit the chart, you have to smart. You have to smart. And that's a 1985 Black Uhuru hit, where in essence he was saying that to do well in his field, which is music, to get to the top of the chart, to be a success, you have to be sharp in mind and sharp in body. And the same goes for anything we do, for whatever organization that we work in. Success requires that we have good health, that we're fit both in mind and body. So that's very important. From 1985, Black Uhuru said it, and it's still very, very relevant today. So I'll look at the context in Jamaica and the health issues that we're dealing with. And there are some real issues, there are some serious issues. For the last 3 decades or more, we have been dealing with a high burden of non-communicable diseases. And these include diabetes, cardiovascular diseases, hypertension, cancers. And these are the leading causes of morbidity and mortality in the Jamaican population. And it represents a major challenge not only on the health system but also on the social and economic development of the country. The reality is that sick days really cost. It costs money to be out of work, time away from work. It makes you unhappy, it affects your social life, and there's a heavy burden. In terms of context, the average life expectancy in Jamaica is now 70.1 years. In the Americas, it's averaging 74.1. Switzerland 83.4 and Japan 83.7. So in essence, we have some amount of work to do to get to a higher life expectancy. So it must be the commitment of all Jamaicans to really play an active role in improving not only our personal health but also the health of our friends and our family. Some key data here: diabetes, and this is from the Jamaica Health and Lifestyle Survey 2017. The prevalence of diabetes 11.9%. For women it was 14.4% and men 9.4%. High cholesterol, 24.6% of individuals take medication for high cholesterol. Hypertension, 33.8% of Jamaicans aged 15 and older had hypertension to deal with. For weight issues, 28.6% of the population obese, 53.8% are overweight, and 43.7% exhibit central obesity. So in a sense, over 70% of our population are either obese or overweight. And the central obesity that I speak to really is around the central area, around the waist. And this type of obesity leads to a lot of the NCDs that we struggle with. If I go back at hypertension, you're looking at 1 in 3 Jamaicans who are impacted by this. In terms of mental health, depression affects 14.3% of the population, with women experiencing significantly higher rates than men. It's almost double for women. So we are dealing with a number of issues. So if you're looking at mental health, you're looking at about 1 in 8, diabetes roughly about 1 in 8 persons, hypertension 1 in 3. So in every family, in every church community, in every workplace, we're all impacted by these illnesses. In terms of lifestyle practices, some information in this area. Vegetable consumption, only 17.6% of Jamaicans eat vegetables 2 or more times per day. For fruit consumption, 12% consume fruits 2 or more times daily. For sugar sweetened beverages, 32.6% of Jamaicans drink these at least once a day or more. And for physical activity, 48.6% of men and 25.9% of women engage in regular physical activity. We also have the issue of motor vehicle accidents and domestic violence, dealing with approximately 8,000 domestic violence cases in 2022 and 425 motor vehicle accidents in 2023. Now, this sort of sets the profile and the context of some of our health challenges that we face. And there's a clear link between health and productivity. Just think of a day when you are at work and not feeling well. Whatever you're doing on that day would normally be less in most instances that you do on your best days. So there's a clear link between health and productivity. Annually, and this is from the World Health Organization study 2017, Protecting Workers' Health. Annually, 12.2 million people, mostly in developing countries, die from NCDs while still of active working age. So they die while they are young and able to work. Work-related health problems result in an economic loss of 4 to 6% of GDP for most countries. That's a significant economic loss. 70% of workers do not have any insurance to compensate them in case of occupational disease and injuries. And this is quite our situation in Jamaica, because I believe only 23% of Jamaicans have good health insurance. Research has also demonstrated that workplace health initiatives can help reduce sick leave and absenteeism by 27% and reduce healthcare costs for companies by 26%. In addition, the American Center of Disease Control, CDC, looked at their situation, and a 2 billion loss was caused by absence of employees at work because of illness in 2016. And working days missed because of chronic diseases cost 153 billion per year. Quite significant. So there's a clear link between health and productivity. And in terms of leadership, leaders make big decisions every day. Leaders make decisions that impact persons short-term, long-term, that impact companies, that impact profitability, and that impact their colleagues. A leader's health directly influences decision making, productivity, and team dynamics. Poor health can cloud judgment, lead to emotional instability, and diminish effectiveness. A healthy leader fosters a positive environment, inspiring trust, energy, and collaboration. So the point here is that the leader cannot afford to be unhealthy, either in mind or body. Either of those can lead to bad decisions that impact productivity and that impact others in a negative way. So this health that we aspire to, this good health that we seek, how do we define it? The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And when you read this definition, it almost seems as if it's impossible to be healthy, because it refers to a state of complete physical, mental, and social well-being. And I don't know of any of us who have ever been in a state where we can say that we're fully fit, our mind is fully intact, and socially we're fully good, and we have no illness, we're fine. So it really is what I call an aspirational definition, something that we're always working towards achieving. And that's going to be a lifelong goal for all of us. Mental health, state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. For physical activity, Movement that allows the body to use energy. Regular physical activity provides significant physical and mental health benefits. In adults, physical activity contributes to prevention and management of non communicable diseases. And social health is a term that refers to the ways in which people create healthy and positive interpersonal relationships with one another. Years ago, in that definition that I spoke to earlier, it also included spiritual health. And I'm of the view that they should have kept that in the definition. So I will still mention it because sometimes in the roughest of our times, in the bad times that we go through, it is through our churches and our church communities that we find comfort and we find ways to express what's happening to us. So spiritual health helps people find meaning and purpose in their lives. And I'm sure that there was good reason why the WHO included it back, I think, in the early 90s when they had that as a part of the definition. So we're striving to all achieve good mental health, good physical health, good social health, and I dare to say good spiritual health. And I think it should be re-included in the WHO definition. But for the purposes of Jamaica, where I know we have probably more churches per square mile than many other countries, we are going to include spiritual health in our definition. So how should leaders prioritize their health? How do we get to that or near to that complete state that the WHO defines? It's going to be a journey, but it has to start with us understanding that our health is our responsibility. Years ago, before we changed, NHF had the slogan, your health is your responsibility. So our encouragement is to first put on your oxygen mask first. That's what they tell us on the plane. Because oftentimes we are giving advice to persons where they're trying to help persons. We're telling people, oh, you need to go to the doctor, when in 3 years you have not had your executive profile done. You have not had your prostate examination. So leaders have to lead by example by first taking their own health into their hands and start making the right decisions around their health, because others can take you as an example when you begin to take that big step to really put your health first, getting your checks done. So I encourage all leaders to put on your oxygen mask first, as they tell you when you are aboard the flight. The big thing that you have to do, and all of us, I'm speaking to myself also, you have to know your numbers. The Ministry of Health is still on that campaign that we launched about a year ago, the Know Your Numbers campaign, and it's very, very relevant. There are so many persons walking around who actually don't know what their key numbers are. They don't know what their blood pressure is. They don't know their cholesterol levels or their blood sugar levels. And it's just so important, because you may be unhealthy and you're assuming you're well when you're certainly not well. It really is very important to be open with your medical professionals, to know your medications and to take them, and to set a time every year to do your annual physical examination. So set a time. It may be around your birthday, it may be the start of the year, but set some time, a day every year, where you focus on your health and your well-being, and you get those checks done. And not only get them done, but keep the numbers so you can look year to year how you're performing. Many leaders have all these spreadsheets on their desk. They're tracking customer satisfaction year to year. They're tracking profits year to year. They're tracking so many parameters in their organization every year. the first track that you need to do is a track of your health. Year by year, how am I doing? One of the big things that I'd want to highlight, because it's just so important and I've observed it for years, is the issue of fear. And fear by itself is almost becoming a NCD, because the fear of that medical examination drives us away from doing the right thing. So in a sense, we are going about every day, we're assuming things are okay when they're not okay. I recently attended a funeral in Montego Bay for a former colleague of mine who works in health. And he had not been to the doctor in many, many years because of fear. And he actually was ill and he didn't know, and he ended up dying because he didn't get any checks done. So I know that it's a challenge. Even for me, I can tell you it's a challenge. So I have my peers who I have remind me, and I got a reminder up to this week that it's time for my annual checkup. And the males especially, I don't want to really listen and hear this today. You need to act. I know the females are more likely, all the studies we have seen, to get their checkups. But the males, you need to overcome the fear and get your annual checks and keep your health in check. You have to also get moving. You have to get moving. In this age we're in is the most cars I've seen on the road. Everybody is driving, even for short distances. People are using on time and other taxi services and all the others that are there. Growing up, I used to walk from home to the church where everything was, the field was there too, where we played football and other things. So on a Saturday, for example, you would walk in the afternoon for maybe 45 minutes to play volleyball or some other sport. Then you walk back home, then you shower, eat, and then you walk back there to go to youth fellowship and walk back. These days, everybody has a car and we are not moving enough. So the Ministry of Health and Wellness, PAHO, WHO, all recommend that we engage in regular physical activity, as it plays a vital role as a protective and preventative factor for health and well-being. Adults should engage in moderate to vigorous physical activity at least 5 days per week, at least 30 minutes, 5 days per week, to gain some health benefits. Physical activity is also important in the management of common NCDs such as diabetes, hypertension, and mental illness. And even while you are at work, there was a phrase called management by walkabout. We may need to practice more of that. So rather than calling someone on their extension, walk to them, walk to somebody else, and over time you find that you have that habit. But we definitely need to move more. I have one colleague I gather after lunch every day. We're on the 6th floor. I gather she walks up to 12. I don't know how many times she walks up there, but that's one good habit that some of us may need to copy from her. But we have to keep moving. The body was meant to move, and we have to keep moving. Get up out of your chair, park the car sometimes, and get moving. Now, this is a challenging one. A balanced diet. People struggle with this one, all of us. Eating healthy is an important step to a healthy, happier life. And a balanced diet consists of a wide variety of foods such as fruits, vegetables, protein, starches, a good mix of all of that. Having a balanced diet gives your body adequate minerals and nutrients it requires. And it really also impacts how NCDs are treated, or we manage our diabetes and hypertension. So consultation with your dietitian and doctor will help you in defining what to you is a balanced diet, because while the guidelines speak to a proper mix of vegetables and fruits and minimizing in some case carbs, not eliminating, and enough protein, individual recommendations will be different. And I know it's challenging to sometimes balance that diet. Sometimes it's economic, sometimes it's addiction to some foods which we all have. I remember one year we had our internal work it out challenge, and we compete in teams and we get prizes for weight loss and all of that. And I was on a specific program for the time that we had the competition, and I did very, very well for about 4 weeks of the campaign. I was balancing well, enough vegetables and all of that, doing gym. And then one evening I didn't cook, so I decided to go to Burger King to get a salad at the time. And right up to driving up to the window, I was clear as to which salad I would have. I, however, went up there, and upon exiting, I realized that I had a Whopper with cheese and fries and a soda. And I had to confess to my teammates at the time that I had a bad eating day. But sometimes that will happen. Don't feel too bad about it, because you also have to be happy. And a good mix of everything is important as we work to manage our health. We also encourage that you do not skip meals. I know some people now do intermittent fasting, so a later breakfast may be okay, but try not to skip meals. Practice eating healthy snacks at various time intervals. And I've had to remind some of my colleagues of what those healthy snacks are, because they have a supermarket at their desk and that has many chips. So we're replacing some of those chips with nuts and other healthy snacks. Stay hydrated throughout the day, drink water, and try to prepare nutritious meals at home. This slide had initially said try to prepare meals at home, but we insisted that we put in the word nutritious, because cooking at home does not always mean that you cook nutritious meals. You may cook meals that are even worse than what you would buy at fast food establishments. So an unhealthy diet and lack of physical activity are really leading global risks to health. And we have to recognize this as fact and act accordingly to protect our health. And I'd like to add to this that along with the unhealthy diet and lack of physical activity, the use of tobacco and the excessive use of alcohol are some of the major risk factors that lead to the NCDs that are affecting our population. Rest is also super important. Very, very important. I gather for many persons now, the habit is to go in bed. You may go early, but you're on TikTok for 2 hours. So you end up going to bed very late and getting very few hours of sleep. Sleep allows your body to rest and repair itself. It is recommended that adults get 7 or more hours of sleep per night. In fact, my colleague says 7 to 9 hours of sleep per night. Rest is crucial in maintaining health and well-being. By allowing our bodies time to recover, it helps to prevent injuries and improve overall performance. Rest helps to manage stress levels and helps to lower blood pressure. And in terms of sleep, I think there are about 80 recognized sleep disorders. So if you're not sleeping well, I would recommend that you consult an appropriate medical practitioner to look at what the issues are, because this lack of sleep can lead to so many other health challenges. So it's so very important that we prioritize rest as a part of our overall health strategy. And in keeping with our commitment earlier, spiritual health and meditation, leaders should nurture their own spiritual health. Dedicate time to reflect on personal values, goals, and decisions through self reflection. Set time for activities that nourish the spirit, such as spending time in nature, prayer, and at your place of worship. Cultivate gratitude and positivity. Engage in a community or network that supports spiritual growth. Because, as I mentioned earlier, sometimes in our toughest days, in our darkest days, it is those communities, those churches, those pastors that are able to spend some time to you to provide the support and to provide the hope that we need to go forward as individuals. So in terms of prioritizing, just to summarize, actively take all aspects of your health and your well-being in your hands. Take time to evaluate your needs, demands, and pursuits. Celebrate the hard work and victories in your personal lives and at work with teammates. Have a positive mindset in managing health conditions, and that particular one I'd like to just spend a little time on. There are persons who will obviously be faced with NCDs and other challenges. And the message this morning is that you can have an illness, but you can still be healthy. I've known persons who have had 3-4 illnesses for 40 years, 30 years, and they've been managing them through discipline and taking the right actions. So the fact that you have an illness does not mean that you cannot achieve and aspire to good health. And I think that's something that we should all recognize, because sometimes we're living in this paradigm where we're saying take all these actions and you'll be well. It doesn't actually work like that. You will take the actions, but regardless of that, there are still people who will graduate into facing some NCD or other conditions. It does not mean that you cannot strive towards good health. And I have so many friends and colleagues and persons who have interacted with for years, who have shown me and have been great examples to me that even with a condition or an illness, you can still lead a very productive life. You can still be healthy. It takes a lot in terms of discipline. It takes a lot in terms of compliance with your medication, eating differently, and also trusting in the Father. But have a positive mindset. Despite having a health condition, you can still strive towards health. Another role of the leader, which I think is really a big deal, it's very important. I think leaders must be health champions and health ambassadors, both in their homes and in their workplaces. We're all going through a lot. In fact, the slides I pushed earlier, you would have realized just how many persons are affected by illness. For hypertension, 1 in 3. For diabetes, 1 in 8. For mental health, 1 in 8. So it means that in most families, in most workplaces, we're interacting with persons every day who are facing a number of challenges. So the commitment that we must have as leaders is to be health champions and health ambassadors, helping persons even while we help ourselves. And we're acknowledging the role of the ambassador as very important, because there are a lot of issues facing the workforce, a lot of issues. We're going through it, not only in Jamaica, but globally. And these are just some of the issues. I start with illness. I mentioned earlier the disease burden of our country. It affects us, it affects our families, it affects our friends. Sometimes it even affects strangers, and we become affected by it because your heart just tugs sometimes when you see somebody going through something and you say, boy, that must be rough on them. Stress, work stress, family stress, the stress in the traffic that we face sometimes driving to work is just such a challenge. When you get to work, you're so tired because of the traffic. Burnout, that's a big one. Burnout, working long hours, just being tired all the time. Fear, fear of the future, fear of illness. And another issue facing us would be conflicts, interpersonal conflicts, whether it be at home, but a lot of times at work. Unnecessary interpersonal conflicts that affect our peace, affect our well-being, affect our happiness, affect our health. So we're going through a lot in terms of the workforce, and we have to be there to support each other and to make each other better. Burnout is one that I'll face, that I look on, because it affects so many of us. We are working too many hours. And I remember years ago you had the European Working Time Directive for clinicians that really limited the number of hours a clinician could work per week. I think they capped it at the time at 60 hours because they realized that there was significant burnout, and in that kind of clinical field that leads to errors and could lead to very bad care and dangerous care for patients. So burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. And there are three dimensions: feelings of energy depletion or exhaustion, increased mental distance from one's job, or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. So these are the three dimensions of burnout. And burnout leads to a number of challenges: excessive stress, fatigue, insomnia, we mentioned sleep earlier, sadness, anger, irritability, alcohol or substance misuse, heart disease, high blood pressure, type 2 diabetes, and vulnerability to illnesses. And these are some of the issues that as leaders we have to accept we'll have to deal with in the space called work, and we have to find ways to deal with this. So how do we address these issues? Because while we as leaders strive to be healthy and productive, the reality is that organizations can never be run it can never be run well by one person. And so it's also very important that our teams be healthy and that we be the ambassadors for our teams. So a healthy leader, healthy workforce will give us some very great results. So in terms of recommendations to address these issues, let me just play a video. I hope you can hear it. Jeff Bezos, the Amazon founder, before I get into my major recommendation on this.
I don't even like the phrase work-life balance. I think it's misleading. I like the phrase work-life harmony because I know that if I am energized at work, happy at work, feeling like I'm adding value, part of a team, whatever energizes you, that makes me better at home. It makes me a better husband, a better father, and likewise, if I'm happy at home, it makes me a better employee, better boss, all the things. It's not primarily about, there may be crunch periods where it's about the number of hours in the week, but that's not the real thing. Usually it's about, do you have energy? And is your work depriving you of energy, or is your work generating energy for you?
So what we want is for our workplaces to be generating energy. So we're actually sending home people in a better mood. We're sending home better wives, better husbands, better fathers, better mothers, better sisters, better brothers. So the workplace in essence should be a place of healing and should be a space where you're comfortable, where you're not stressed. And I would recommend that in 2025, every single organization should establish a workplace wellness program, and not just something that sounds good, but a strong workplace wellness program. The goal of any workplace wellness program is to improve employee health in order to have a full and functionable workforce, boost employee productivity, build a positive company culture, attract and retain talented staff, and reduce healthcare costs. So these are some of the goals of a proper workplace wellness program. And I'm going to just share with you what we have been doing at the NHF with our workplace wellness program. We have had a very active program for a few years now, and that was because we actually saw the need to look after the health worker, because so many health workers spend so much time looking after others that at times you forget to look after yourself. So in terms of the goals that we set out, we wanted to increase awareness of healthy lifestyle and personal health among our employees. We also wanted to increase physical activity levels of our staff and establish wellness ambassadors across the organization. So we've been able to do annual staff screenings almost every year for the last few years. We currently operate, I think, 106 locations. So we try to cover most locations over a 2-year period, and then repeat that cycle. And during the annual staff screening days, we try to get everyone to know their numbers unless they go in hiding when the screening team comes, like 1 or 2 males in the organization do. We also have other added things like massages, etc., so people can just have a good wellness day. We also look at the days that commemorate certain key illnesses and focus our education and awareness around those days. For example, Prostate Cancer Awareness Day, Breast Cancer Awareness and Heart Month, just reminding our teams that we have to look at these issues and that we must move the fear away and get our necessary checks done. In terms of physical activity, we have our internal Work It Out challenge. We have an external one that involves Jamaicans wishing to participate, but we also have a Work It Out challenge internally that staff participate in, where they try to not only lose weight but participate in physical activity and show evidence of it. We also encourage participation in 5K events from our team and 10Ks when they have 10Ks. We have also trained a number of health and wellness ambassadors across the organization. 52 health ambassadors were trained in 2019, and we have had refresher training for these health ambassadors, who we expect to carry the message of health and wellness and taking control of your health across the organization. The other initiatives that we've done under our program, we have had talks and webinars with staff. We've brought in different health professionals, financial groups, life insurance agencies, and we've provided counseling services that are external to the organization. So when staff members are going through things, which will happen at some point, they have an external person to speak to and to get the necessary counseling and support. We also have had, as a part of our wellness program, our annual general devotion, where we all just come together to express gratitude to the Creator for being here and to pray for a good year and just to really do some team building. So workplace wellness programs are about creating a culture of health in the workplace to increase team engagement, morale, and enhance organizational reputation. So leaders should encourage workplace wellness programs and initiatives as an investment in staff. And I say investment because a lot of times if we're able to address the health issues early, it's actually a lower cost both to the individual and the organization. We did screening in one organization years ago, and I remember at least 5 of the gentlemen indicated that as a result of the screening, they were able to pick up the fact that they had issues with their prostate that could be dangerous, and those issues were able to be addressed. So we ask ourselves now, if these guys had waited and waited and waited, maybe it is that the cost would be their lives, and even if they live, it would be a higher cost to repair and fix issues. So we're seeing the workplace wellness program as an investment in our people and as an investment in our staff. And the benefits globally that we've seen, and this is a study, a 2019 study, absenteeism reduced by 41%, productivity increased by 17%, safety concerns reduced by 70%, and profitability increased by 21%, where we have strong wellness programs in place. So I think the evidence is clear. And these are just some of the photos we're sharing of our last Wellness Day event. You'll see me there. I had not yet got my screening, and the meal is healthy. The other recommendation is more flexibility in terms of work hours. The reality is that, as I mentioned, we're all going through stuff. Traffic is one thing we're going through. The 9 to 5 sometimes blocks us from doing so many other things that are important to our health and well-being. Sometimes even paying bills is an issue. So we have gone flexi as much as we can, and I would encourage all organizations to have those individual discussions with team members to see what works for them. And of course, you're not going to be able to reach full agreement with everybody, but I think for good staff, for productive staff, it will even get better. Their work will even get better when you're able to reach an appropriate agreement that works for them, that takes them out of the traffic, that gives them more time with their family. I think we'll have better outcomes as a result. Vacation leave. I worked, when I just started working in public sector, you could have 105 days leave. You could accumulate, I think it was 35 days per year. And there are so many persons who would always get to 105 and then ask to accumulate leave. And I'm seeing it in so many organizations that people want to build up big leave balances. Well, I think leaders have to start by example. Take time away every year and encourage your staff to take time away from work, to rest, go to the beach, go to the river and cook a pot, do something away from work, disconnect from work, and stop piling up 60 days and 70 days leave. I know sometimes it may be for financial reasons, but the reality is that if you don't rest, sometimes you may not get to enjoy that money anyway. So it's very important to take the time off. In terms of future plans though to achieve better health, I said it before, but I'm gonna re-emphasize it. We have to prioritize self-care. If we don't take care of ourselves, who is gonna take care of us? We have to prioritize self-care. Look after your mind, look after your body, prepare your meals, your good nutritious meals, get your exercise, and set that date every year to look after yourself. Know your numbers. I can't emphasize it enough, because through the years I've seen so many persons who could have had a longer lifespan, who could have enjoyed better health, but they waited too long to actually begin to take care of themselves. They're walking around sick and didn't know. So in terms of the future, I think we have to have that commitment to self-care, taking a spa day just to relax, disconnecting from the phone and connecting with nature, spending time with people who you care about. This year, for example, I've set as a personal goal to reconnect with some of the people who have been so good to you in your life, but sometimes you get so busy that you're encountering and only meeting these people at funerals and other gatherings. So I'm setting time to just interact and have some fun with sometimes my friends from primary school, for example, who, yes, you have a lifelong friendship, but you may see each other every 5 years, when in essence you can just set some time that we can all relax and talk and laugh and be happy. So we have to prioritize self-care. The second thing we're going to have to do is redefine staff welfare. And I know many HR departments look at staff welfare as the basket when you're in the hospital, the staff party, and other such delights. But staff welfare is going to have to mean a lot more if we're going to have to get healthy. We're going to have to look at how we educate our staff and ourselves about what to eat for breakfast, lunch, and dinner. We're going to have to create a space for people to have more physical activity. We're going to have to create the space where you have a space at work where you can probably walk around the building, or you have an accountability partner. So we're going to have to redefine what staff welfare means and move away. Yes, we still want the staff social. Yes, we still want the basket. But we also want the things that will keep us healthy, the things that will keep us alive. So bring in the experts. Have a day where people come and lecture on mental health, and lecture on physical health. Have some cooking sessions where you have people who are good at meal prep come and staff. So we're going to have to redefine staff welfare as we strive towards better health. And I think it's also going to be very important. I know that most organizations have a cap as to how much time you can, how much leave you can accumulate. So for some organizations it's 60 days, for some it's more. But I think organizations now need to mandate time away from work, and my preference would be no contact time. So you have some people who go off and work on a Monday, and by Monday afternoon they're calling you, asking if everything is okay at the desk. The work will go on with or without you. So I would say whatever leave you get, at least 2 weeks every year, you should take time away. In some other countries they call it non-contact time. And for some of us leaders, I know it's difficult, because even when you're off, people are still calling. So you may have to put in special arrangements that everybody knows that I'm off, and these are the persons who you need to call, because if you should fall by the wayside, they will move on very quickly and they'll be calling other persons. So you have to mandate time to do things that make you happy and to spend time with your family, because that will ultimately lead to you becoming even more productive at work when you get back. Because when you're there working 9, 10, 11, 12 hours a day, yes, you may be effective, but a clearer mind actually makes you more productive. And sometimes it's when you're off on those non-contact times that you sometimes get those light bulb ideas. The other big thing I'd want to mention, and this is very important, is health coverage. Only about 23% of Jamaicans have proper health coverage. So it means there's a significant gap. And what it therefore means in terms of the issues we discussed earlier in terms of what we're facing is that when you get ill, it's going to be sometimes harder to immediately access the care that you need. So I think as a country, we must commit, every single one of us, every single leader, whether in private or public, to look at our health packages to ensure that our team gets a package that covers, one, your preventative health. So you're able to get a proper and complete full check from your health plan every year. And two, your health plan should be able to address your urgent needs and your serious health issues, because delay in this field will lead to bad outcomes. So in the case of cancer, for example, just to give an example, you'd want, after diagnosis, to be able to get surgery within 2 weeks. If you need chemo after, you want to be able to get the drugs. These are expensive items. So if you have significant delays in that, it means that your health deteriorates during that time. So the issue of better health coverage is something that we really have to push for. And I couldn't come here without reminding you that the NHF is here for health, and the NHF is here for you. So as you strive to improve and maintain your health, we're also here to offer support. We cover, through our NHF card, 22 chronic illnesses, and you get JADEP benefits, and the subsidies are for prescription drugs, respiratory devices, diabetic supplies, and diagnostic tests. And we're also heavily involved in health promotion, and we do a lot of screening right across Jamaica, especially with our partners, the Diabetes Foundation, Diabetes Association, and the Heart Foundation of Jamaica. We do a significant amount of work also with the Jamaica Cancer Society. So we are also here to offer support as you strive for better health. We mentioned earlier that to be successful, fitness and good health is very, very important. And one of the closing arguments that I'd like to posit is that leadership style is also very important. And the emerging thought is that where you have leaders who create conflict, leaders who tend to have a more aggressive approach to their leadership, it's not a good space for good health, either for the leader or for the employee who may be stressed. So the emerging thought is that servant leadership represents the best way for organizations to create harmony and balance and create a space for persons to enjoy good health. And I had to put that in to allow each of us to reflect on how we lead and how we're impacting our teams. And this year, I just want us to focus on getting fit. Black Uhuru said you have to fit, you have to be healthy and fit to get that hit. In the case of Black Uhuru, their hit is a musical hit, because that's what their success is. In our case, it could be customer satisfaction, it could be profit, it could be a new process that makes your customers happy, it could be minimizing your waiting time that could represent your hit. But let us all agree today that we're working towards health and fitness, and that organizations need fit leaders, healthy and fit employees to make those successful hits. In the words of Black Uhuru, we have a fit, we have a fit. Thank you, and I hope that you enjoyed our discussion this morning. Thank you very much.
Okay, thank you very much, Mr. Anderson, for that very insightful and thought-provoking presentation. We would like to invite you now to post any questions you have. The chat feature is enabled, and you can post your questions there, as well as you can post your questions in the Q&A feature as well. So there's a question, Mr. Anderson, from Naomi Jackson Forrester. Do the NHF diagnostic tests only cover prostate and pap smears?
If I'm hearing correctly, just to advise that we also cover HbA1c and breast cancer receptor studies.
Okay. What is that HP? Go again.
HbA1c and breast cancer receptor studies.
And what is HbA1c?
Oh, that's your average 3-month blood sugar test.
Okay. Test. Okay. And I saw another question a while ago asking if there are any places where you can get free mammograms. I'm scrolling up just to make sure. Yeah. Are there places where you can go to do free mammograms?
All right, so
Of course, go ahead.
So we partner with the Jamaica Cancer Society, and we actually sponsor quite a number of mammograms annually throughout the country, and those are free of charge to the patient. So we actually pay the Jamaica Cancer Society, and then they administer the mammograms as they go out throughout the country. So there are some possibilities there.
So how do you access that? You have to register with NHF? How do you?
Right. Well, what we do, we look at where they're going. So it's not like a benefit on the NHF card. It's just something that we go out and offer to the communities. So depending on the community where that person is, we could let them know when the Cancer Society will be passing through that area.
Oh, I see. Okay. There's a question, is it possible for organizations to contact your entity to arrange for this kind of material to be shared with staff?
Yes, you can just email us, and we actually do quite a number of presentations. We also do our own health fairs every year. So we do health fairs basically throughout Jamaica every year, and we do health sessions. So if we're not able to present, sometimes we get a presenter depending on the topic. So we tend to be pretty involved in the health space across the country.
Okay. There's a question, does NHF visit offices to register persons?
Well, we have various means to register. Registration is normally done by the doctor. So, and it can also be done online by the doctors now. So typically once you go to your doctor, you bring in the form, and we try to have you in and out within 15 minutes. So where we do on-site registration is like we're having a health fair where there's a doctor present, because it's also a requirement that the doctor verify your medical condition.
Okay. We have a slew of questions coming in now. Would NHF visit organizations to help set up those organizations' wellness programs for leaders?
Well, what I'd say, we're open to providing guidance and support to
Mm-hmm.
any organization that wants to establish, because as I expressed earlier, I actually think that it's something that all organizations need to have to not only promote health but to promote harmony and peace, and to really work to make the workspace comfortable for staff,
Yeah.
and work to send home better persons than when they arrived in the morning.
Okay, wonderful, wonderful. There's another question. What are the benefits offered by NHF in relation to, for instance, cancer operations, chemotherapy?
All right, so in terms of cancer operations, those are normally done in the public system or at the operating rooms. We fund something called the Compassionate Fund, but that's at the Ministry of Health, where persons who have significant financial challenges get support. But in terms of other cancer support, I don't know many persons know, but we actually constructed two radiation treatment centers a few years ago, one in Montego Bay and one in Kingston. I was actually the project lead for that, where we were able to install state of the art radiation treatment machines for cancer. And in terms of chemotherapy, we provide those at the major hospitals to patients, and we also provide chemotherapy drugs at some of our drug serves, especially Union Square in Kingston, because that comes with a high cost burden for patients. So we try to minimize that cost for patients. And several cancers are also covered by the NHF card: breast cancer, prostate cancer, and we've recently covered a number of other cancers. So that makes the medicines and the chemo cheaper and more affordable for patients affected by cancer.
Okay, wonderful. That's good to know. So there's a question here. Can a current insurance holder also access NHT/JADEC card? And I think the answer is yes, but it's a doctor who has to fill out the necessary components
Yes,
of
the
the
answer is yes.
application. Yeah.
And it's not
Okay.
NHT, it's NHF.
And
Just
sorry,
being troublesome.
I read what exactly the person asked. So
Yes,
my
I'm just being
bad.
troublesome.
I should have really said NHF, but it's NHT the participant wrote. There's a question here. Will there be workshops in organizations to promote this going forward?
Could you repeat that question?
Will there be workshops in organizations to promote this going forward?
Well, organizations that make a request will consider that, because I don't think any external body can just walk into an organization. But we have partnered with so many organizations. For years, we've partnered, for example, with JCF, JT, and we've done significant work. So we're always willing to be your partner for health.
Okay, wonderful. Thank you. I think that's it for the questions. I'm not seeing any further questions, but in the comments, I must tell you, there are quite a lot of favorable comments about your presentation, Mr. Anderson, in terms of it being informative, educational. Thanks for reminding persons about some of these things that they may have already known. Thank you very much for the reminders and information provided. I wish more organizations will institute ongoing wellness programs and flexible work hours. A number of you are asking if a copy of the presentation will be available. The recording will be uploaded on Mind's YouTube channel. So, of course, you will see the presentation there as well. All right. So thank you once again, Mr. Anderson. Thank you for taking the time out of your busy schedule to be here to provide all the insights. I hope, and I'm almost sure that you have inspired persons on the platform to even go back to the powers that be in their organizations to institute some of these wellness programs so we can all be fit to lead. Ladies and gentlemen, it was a pleasure having you here. I am now posting in the chat a link to our evaluation. We'd like you to just spend a few minutes providing us with valuable feedback on today's presentation. And we look forward to you being here. Just to let you know, we have upcoming webinars next month, February and March. Stay tuned to that in terms of the exciting topics we have lined up for you. Once again, Mr. Anderson, thank you very much for making yourself available.
So much. Thank you.
Thank you. Thank you. So check in the chat. I've posted a link for the evaluation. You can take a few minutes to complete that. I've posted it again. This is a hit song, Mr. Anderson. Black Uhuru?
Yes.
Okay. Keep playing it, man. Keep playing it.
Okay.
So colleagues, have a blessed weekend. Have a fabulous weekend. Try and get some much needed, what we said, 7 to 9 hours sleep, and try and start your journey to being more fit. Exercise, walk for a few minutes. I like that initiative or strategy of one of your employees, Mr. Anderson, where he or she utilizes the lunch hour to, walk up and down a few steps, walk around your building a couple times. You would be surprised how you can easily get in about 15 minutes of,
Definitely.
much valued walking, and ensure that you continue to have a healthy heart. And if you do this 5 times a week, you would have gained invaluable benefits. So once again, thank you. And I will keep the platform open so you can continue to access that evaluation form. So everyone, walk good and be safe.